I'm Dorothy from Taiwan. Today, my presentation title is a pilot study on the user experience of professional caregivers utilizing a screen-based social robot in dementia care. So I'm going to go through background research, aim methods, results, and discussion for today's presentation. First, some facts about dementia. Dementia is a term used to describe different brain disorders that may affect memory, thinking, behavior, and emotion. Actually, it is actually an umbrella term. For example, here we have several types of dementia, like Alzheimer's disease, vascular dementia, Lewy body dementia, frontotemporal dementia, and some other types of dementia. So early symptoms of dementia can include memory loss, difficulty performing familiar tasks, problems with language, and changes in personality. However, the symptoms varied. The symptoms varied between different types of dementia, and actually there is no cure for dementia. So a range of support is available for people with dementia and their caregivers. So as a professor from School of Nursing, we aimed to develop the care strategy, the best care strategies for people with dementia and their caregivers. For Alzheimer's disease, it's the most common cause of dementia. Other causes include like what I just said, vascular dementia, dementia with Lewy bodies or Lewy body dementia, and frontotemporal dementia, and etc. So for prevalence of dementia, we can see here the people living with dementia around the world. Actually, it's there are currently estimated to be over 55 million people worldwide living with dementia. The number of people affected is set to rise to 139 million by 2050, with greatest increases in low and middle income countries. A new case of dementia arises somewhere in the world, like in every 3 decades. So the prevalence is very high and it's still increasing. Dementia is currently the 7th leading cause of death and one of the major causes of disability and dependency among older people globally. If dementia was a country, so it could be 14th largest economy in the world, because the worldwide cost of dementia is around 1.3 trillion a year. So in 2019, dementia cost economies globally $1.3 trillion US. Approximately 50% of those costs are attributable to care provided to informal caregivers, by informal caregivers, sorry. For example, family members and close friends who provide average 5 hours of care and supervision per day. So as we just mentioned, there's currently no cure for dementia. So we have some pharmacological and non-pharmacological treatment for dementia. For pharmacological treatment, we take Alzheimer's disease as an example. We have 2 groups of pharmacological treatment. The first group is symptomatic treatment. For example, we have some cholinesterase inhibitors and NMDA receptor antagonists. Those are the 2 big groups for Alzheimer's pharmacological treatment. And we also have some treatments for neuropsychiatric symptoms. For example, we have some atypical and antipsychotics and antidepressants and anticonvulsants. So for all of those pharmacological treatments, this medicine, actually, they can't cure dementia because we know the process of, for example, take Alzheimer's disease as an example. We have this beta amyloid plaque and also some tau protein. They have the neurofibrillary tangles inside the cells, and we have the beta amyloid plaques outside the cells. And there is no medicine to prevent those kind of procedures. So for this pharmacological treatment, they can only be used for symptomatic treatment. So actually, now the non-pharmacological have a place here. While there are several medications available for clinical use at present, there's no medicine that can cure dementia because it cannot stop the procedure that form dementia. And furthermore, these medications often activate poor response or give rise to severe side effects. That's one of the most important things that pharmacological treatment cannot be widely used for treatment. Although it is being used for most of people who diagnosed as dementia, but it's not the best solution. And so non-pharmacological treatments are receiving increasing attention. But besides this slide, actually, I think by early this year, we have a new medicine for dementia. It can stop. It is claimed that this medicine can stop the plaque forming, the formation of the epithelial plaque outside the brain cells. So it's hopefully it can stop the forming of dementia, but it's still in the during the clinical trial phase. So we are very looking forward to the outcome of that medicine. Okay, so as we said before, non-pharmacological interventions are very important in dementia care. So we have several groups of non-pharmacological interventions. The first one, we call it standard therapies. We have behavior therapy, reality orientation, validation therapy, reminiscence therapy. For behavior therapy, well, it's not that commonly used, but maybe we have the PTSD symptoms for dementia, which is called behavior and psychological symptoms of dementia. It's very common in dementia. People can have a lot of symptoms when maybe some of them are develop this kind of symptoms in the early stage of dementia, and some of them are in the middle stage, not maybe the middle stage. They have the PTSD symptoms. So we have some behavioral therapy to respond to those behaviors, psychiatric behaviors. And for example, reality orientation for example, the daily care centers for dementia patients, people with dementia, we will let them know the date, the season, the location of where they are. We need to remind them all the time. So that is called reality orientation. Otherwise, they will think they are, for example, if they are already 80 years old, but they may think they are only like 20 or even 10 years old. They are looking for their mommy, or they can't recognize people around them. So we need to remind them, or remind them the reality. Well, every now and then, hopefully all the time, so that they can remind themselves. And we cannot stop the symptoms to develop. We can postpone the serious symptoms to develop. And validation therapy, reminiscence therapy means we need to help them to recall their early memories. For example, we can go through the old photos with them, or have them listening to the old music to keep their memories alive, sort of like that, to help them not miss those memories. And also the second group of non-pharmacological interventions are alternative therapies. We have like art therapy, music therapy, activity therapy, complementary therapy, aromatherapy, bright light therapy, multi-sensory approaches. So I think these approaches are very easily to be understood by their names. And they're very popular nowadays for people with dementia. And also we have some brief psychotherapies, for example, cognitive behavior therapy, interpersonal therapy. For cognitive behavior therapy, sometimes we ask them to do this kind of cognitive games to help stimulate their memory forming, new memories forming. Because for people with dementia, especially with Alzheimer's, the first memory they lose is not their old memories, is their new memories, because the first part in brain that affected people with Alzheimer's is hippocampus. So it's very important in forming new memories. and it's very hard for them to remember the recent issues, recent events. It's not like, for example, if we are getting age, sometime we can't remember maybe something, or where did I put my key, or where did I put my purse, things like that. It's just not like you are going to be diagnosed as dementia if you forgot your keys, or where you put your purse sometimes. But how do we differentiate if you are just maybe a little bit age, or if you are diagnosed, if you are maybe potential to develop dementia? The thing is that the time, the frequency, and also the importance of the event. For example, we may forget where we put our key, but maybe you can't forget today is your daughter's wedding, things like that. But for people with dementia, or maybe an important date with their friends, maybe a few days ago or just yesterday, they will totally forget that. They will not even remember there was that appointment. For us, maybe we would think, oh, when is that? But for people with dementia, or maybe Alzheimer's disease, they cannot recall there is an appointment, not only the appointment time. So we need to ask them to do maybe some cognitive games to stimulate their cognitive functions, because for dementia, it's basically neurodegenerative disease. So if you stimulate the brain function, it will stay healthy for a little bit longer time. Okay, so something about social robots and dementia. That's kind of the topic of today. So in recent years, the effectiveness of social robots in dementia has been receiving increasing attention. Social robots provide various solutions to meet the needs of dementia care, enabling therapeutic approaches that traditional non-pharmacological treatments cannot achieve. I will show you a few examples in the next slide. So the effects of social robots on dementia include reduce the frequency and the severity of behavior and the psychological symptoms of dementia, which is PTSD I just mentioned. Elevate negative emotions such as depression and anxiety, enhance social engagement and participation, improving the overall quality of life for dementia patients, and also reduce the caregiving burden on dementia caregivers. So there are here are some examples of social robots. We have different social robots have varying appearances and functions. So they can be roughly categorized, grouped into three types. The first type is animal-like social robots, which provide the benefits of pets can bring. For example, this one. Can you recognize what that is? What animal that is? Yeah, it's a seal. Thank you. It's a very cute seal. It's a parrot. It's actually it was developed in Japan, and it won a Guinness worldwide prize for the cutest, almost therapeutic the robot in the world. And this is able. It's also developed in Japan, and it's a very cute robot. I think it has several generations of the social robots, and now it's the third generation. It's very cute dog robot. So it's the first type. And the benefits of this type to people with dementia or the caregivers or maybe the pets can bring. For example, if the person with dementia, he or she needs a company, but no one can provide that a company like 24 hours a day. But so this person cannot raise a pet by him or herself. So because it could be very difficult to raise a real pet, and also the pet can bite or have some other issues that need to be handled. So this kind of robot pets can be very therapeutic for this kind of situations. The second type is humanoid company robots. It's, for example, nail I think it's a robot from France. And this is Tremaster Hello Baby. This is a robot from Korea. So these are humanoid, and also Pepper is also from Japan. These are humanoid companion robots. It looks like a human. The third type is a screen-based companion robot equipped with a built-in natural language processor. They can engage in direct communication, but there is a significant variation in the fluency and intelligence level of communication between robots. For example, Pepper looks like a human, but also with a screen on it. So we can call it a humanoid screen-based companion robot. It's not that strict categorizing. And this is Lembo, this is from Taiwan. And for today, we are not using any of them because there is a very difficult or a very big issue of these robots. I'm not sure if you can guess what the issue is. It's very, yes, thank you. It's very expensive. And I'm not saying all of them, but most of them are very expensive. For example, the Parrot, it's around $6,000 US. 20 years ago. I'm not sure if at least 10 years ago. I mean, it's very not affordable for most households or maybe most institutions. So today, for my study, I use this little robot. It's called Tabby. I didn't develop it. It was developed by a company in Taiwan. And before introducing this little guy, would you please maybe have a guess of how much this little guy is compared to the $6,000 US Parrot, famous Parrot? 1,000? Parrot? 200? 200? Oh, 200 is too, maybe, let me see, it's 670, not 100, I think. That's not true. Oh, sorry. 700 US dollars, around 700 US dollars. So it's very cheap in the robots world. It's very cheap. And this is a very little guy. And for example, here it's a screen-based simulated humanoid child. It looks like child, and the voice is also sounds like child. And it's only 25 kilograms, so it's very light, not that heavy. You can carry it around. And there are wheels on the bottom of this robot, so it can follow you like somehow. But I don't think if they have the following, yes, if you do the video calling, it can follow you, or you can just remotely operate this little guy. All right, thank you. So I want to talk about how we use Tabby in dementia. So we just found this robot in the market, and we thought it's very suitable for care, maybe not only in dementia, also in aging. For my study, I also use it in people, older adults who maybe need a company or need a cognitive training. So the key functions intended for dementia care of KB, it is called KB, included telecommunication, singing and dancing, and also programmed activities. For singing and dancing, we use music therapy or dance movement therapy. The older adults, I'm not sure if you have heard about that. If, for example, for older adults living in the institutions, nursing homes, people will, lead them to do some movements, everyday physical movements, but older adults are very reluctant to follow them. But once we bring this little guy to the nursing homes, it's very popular. And for people with dementia, if they can't move if their movements are very limited, they will try to follow the little robot. They like it very much. And we can use it for telecommunication compared with just a screen. This one, you're feeling like you're talking to a human. And also for the third group, we use some cognitive games. For example, we can use them for play therapy or memory, language, spatial sense, calculation, judgment, abstract thinking, attention, things like that. And for this study, just maybe a few minutes, I'll just quickly go through the aim. The aim aimed to investigate the user experience of professional dementia caregivers interacting with a screen-based social robot. So this is only a very small pilot study. We bring this little robot to a nursing home, and it's just a 2-hour activity commencing a researcher-led demonstration, followed by an unguided interaction with the robot. So our participants are formal caregivers for dementia. So we'll use the UEQ user experience questionnaire and SUS system usability scale to collect the data. And for the UEQ, we have this kind of aspects: attractiveness, perspicuity and efficiency, dependency, stimulation, and novelty. And for SUS, we just collect if the system is very easy to use. So these are the two main form questionnaires we used to collect our data. So we have 23 participants in total, and most of them were female, and their average age around 45, and they have very long experience as a caregiver and around 5 years of experience of a caregiver as a dementia caregiver. And for the SUS, okay, these are the, sorry. So for UEQ, these are the results actually. If the values are over 0.8, it represents a positive education evaluation and values. So you can see here we have all the aspects. The score over 0.8, and the highest is attractiveness, which is very acceptable because this little robot is very attractive, and for other aspects, they are also very optimal. And for SUS, the average total score for SUS of caregivers is 6.8. Actually, if it's over 50, it's under 50, it's considered poor. And if it's about 70, it's considered good. So for this score, it's not that, it's not very positive, but it's not poor at least. This is actually the perspective of caregivers. They evaluate the robot, and for this SUS score, we ask them to evaluate this robot as when they pretend they are people with dementia, because they know their patients very well. So we ask them if they were people with dementia, how would they evaluate this robots? Can they operate the robot by themselves for people with dementia? So the score is of course lower, but still they think they can afford, they're able to operate this robot. So for the conclusion, I think this is the last slide. Professional caregivers exhibited significant enthusiasm towards the incorporation of screen-based social robots in dementia care, predominantly driven by the attractiveness of the technology. Nevertheless, system usability concerns emerged. So we need to work on how to help them to use these robots very easily. And future endeavors should explore deeper into both formal and informal caregivers' experience with such robots, and we need to refine the systems to optimal dementia care needs. I think that's mine.
Is this what we use? What is aging? What is dementia?
Oh no, we can't use that to diagnose which people have dementia. But actually, because there is a very important questionnaire to diagnose dementia, it's called MMSE. Yeah, maybe some of you have heard it. We are thinking to implant this questionnaire into the robot. So maybe people with dementia, we will put this robot in community. And for people who are aged maybe like 65, they can interact with this robot and ask questions. Maybe this robot can track their status to tell them if they're at risk of developing dementia.
Is there any different handling procedure for dementia patient for old people like me.
I'm sure. Yeah, you mean handling process by, sorry.
Very nice.
Uh, yeah. I mean, it's very challenging for for caregivers to take care of people with dementia because they have a lot of symptoms. So they need to, they need to have when they need to remember they are patients. They can't, for example, they will ask you questions repeatedly, like what the time it is, and they will ask you like 2 seconds later, like nothing happened. That will drive you crazy. So for people who care about, for caregivers who care people with dementia, they really need to be. I'm not going to use the word patient because it's very not patience. Patience cannot solve the problem. You need a lot of strategies. Yes, actually, I think UCLA have a series of videos to teach people how to take care of people with dementia. They're amazing. Yes, for example, how to communicate, how to act, things like that. Yes.
Thank you.
Thank you very much.
So based on my understanding, for dementia, you have some medications. For people with senior aging, you don't have any drug.
We don't have any drug to prevent them, but we can, do some physical activities. That's the thing for sure. That's the only evidence we found can prevent dementia. Yes. So.
That's a very good point.